Hello, I'm Dr. Reeves. I'm speaking about a study for veterans and first responders that have post-traumatic stress disorder. This will be using glucose. Glucose is a simple sugar. It is the only sugar that powers our brain. It is the primary sugar that powers our nerves, and it is found to be very important in the treatment of pain and other similar conditions. Here's the topics that we'll be talking about. First, where did this idea come from? Unexpected results. Often in the practice of medicine, when something surprising happens, it alerts you to a potential and new idea or a new application, and that's what happened. I had a patient who was being seen for pain, and she was very difficult to treat. She was having stubborn neck and head pain, and I was confused by the level of difficulty. Then, at one visit, she communicated with me that for the last year she was not able to leave her home without her husband because of severe post-traumatic stress disorder. After 3 injections, she said she could leave her house alone. She indicated that the doorbell would trigger panic and she would hide until people leave. After treatment, she indicated she could answer the door. Coping mechanisms no longer worked for her, and she had had PTSD and was treated with many different methods, and she couldn't use them effectively. After treatment, she could use her therapy tools. And she also said she hit her head against a wall frequently until her pain exceeded her suicidal thoughts and uncontrolled emotions. And this is why she was such a difficult pain patient to treat. After treatment, she was no longer self-harming. She also indicated, I rate my PTSD symptoms at 9/10 before treatment, and after treatment, here's what she said. I still see danger in places that others do not, but I'm not reacting as if I'm truly in danger. I still feel it, but I can distinguish the difference. I rate PTSD symptoms 4 to 5/10. I've been able to manage stress, relationships, and responsibilities. So essentially what happened is I treated her for pain, and within 1 to 2 minutes of injecting with a tiny needle underneath a muscle in the neck, she indicated she had suddenly relaxed. And I went ahead and treated her every 2 weeks for 3 injections. And the results you see on the right side then of this slide. What's the situation in post-traumatic stress disorder? The nervous system is out of balance. We have an autonomic nervous system that we don't control, tends to control us. And it has 2 parts, a sympathetic nervous system, which is the fight or flight system, and it's overactive. It has to be overactive because it saves our lives by putting us on high alert when we're in dangerous situations. But then that overactivity persists too long. The parasympathetic nervous system is the tension relieving system, and it is underactive or asleep. The goal of this study is to restore function and to prove it. That's what a clinical study is about. The goal of treatment here is to restore balance, complement other treatments, and restore full family life and workability. Is this realistic? We think so. How does it work? We expect it works by calming the sympathetic or awakening the parasympathetic nervous systems, or both. So it is expected to make the sympathetic nervous system calm down or awaken the parasympathetic nervous system so it's active. We think that probably it works more on the parasympathetic nervous system, and here's why. If you look at these 2 ultrasound images, you will see that there's an SCM muscle. That's the muscle you feel right on the side of your neck. And underneath that muscle is a space that you see in red on the left. That space is where the cervical plexus is running. And it's a bunch of very tiny nerves. And if you place an acupuncture-sized needle through that muscle, you can fill up that space with dextrose very easily, and you see that space has been filled up on the right side. If you look closely at that little circle called vagus nerve, the vagus nerve is the major carrier of parasympathetic impulses, and it's so close by the area of dextrose injection that dextrose can very easily flow across the membrane and encircle the vagus nerve. What is the study design? Well, essentially, everyone gets treated. Here's how that happens. First, there's online screening that takes place at ptsdkansascity.com. Next, there's a virtual screening that occurs with one of two study coordinators, and then you are admitted to the study. When you come in, you open your own randomization envelope. This will tell you if you are assigned to treatment right away or if you need to wait 3 months. Those are the two groups. After 3 months, treatment is given as needed to both groups, so everyone gets treated. Data is gathered until 12 months and the study ends. Needle phobics are welcome. It's important to know that this treatment is very well tolerated. Why? Well, first we use an anesthetic bump with a tiny needle that eliminates sharpness, and you can notice you don't really see that needle here. It is in the acupuncture range. Injection feels like a little pinch. Strange sensations can occur with injection, but they're explained and they're temporary. The needle is so small, injection is so shallow, and you often can't see the needle on ultrasound. On the image there, you'll notice it's depicted that the injection is typically about 1.5 centimeter or 1 inch deep. The study was designed by experienced researchers. That's because for years, research has been accumulating showing that glucose, or dextrose is another name, has been successfully used for the treatment of many types of pain. I have listed a link to Mayo Clinic proceedings where one of our articles was published. I have co-authored 8 previous successful randomized trials using glucose for various pain conditions. And it's very important to note that the nerves that cause chronic pain are C fibers, small diameter nerves. And these same C fibers, or the same type of C fibers, are the ones that cause problems in PTSD. So we think that we're treating PTSD by calming these nerves, just like we do with chronic pain. My other co-authors here, or co-researchers that help design and will help with various aspects of the study, include Dr. David Robigo from Penn State University, Dr. Ann-Lin Cheng from the University of Missouri Kansas City School of Medicine, Dr. Stanley Lam from Chinese University of Hong Kong, and Dr. Sean Mulvaney. Now, Dr. Mulvaney is a former Navy SEAL officer and authored a related study that you'll see listed here by link. There is no pharmaceutical company involvement here, no bias through their involvement. This is a self-funded study. The candidates here are active retired veterans and first responders. For more study description and a potential enrollment, go to ptsdkansascity.com. Now, we can't make any guarantees about benefit here, but I can tell you that our observation, which has been in patients with chronic pain with PTSD, is that improvements appear to be very quick, on the order of 50% or more in improvement, and improvements continue beyond that point and stabilize. So our hope is the same thing, and we want to prove that by doing this study. So the study is being done in hope of helping our fine men and women. Thank you for the privilege of presenting this study. Thank you for your service, and please share this video with others. Good night or good day.